Thank you very much, Paul. It's my great privilege and frankly pleasure today to introduce you to Michael Dowling. Michael started with one hospital and grew it into, well, one of the largest health systems in the United States today in one of the most competitive markets the United States currently claims. It happened during a crisis of late. In some very real sense, he defines the future that we will all soon face. Michael, thanks for being with us.
Thank you very much, Brent. It's an absolute pleasure. I'm delighted to be with you.
You know, back in the day, I remember hearing about a solid quality program at North Shore University Hospital. It was outside New York City, out on Long Island. It eventually transformed into Northwell Health. The thing that really strikes me about Northwell is that massive rapid growth in one of the most competitive healthcare markets in the U.S., but it was built on a quality strategy. Well, how did it start? What is it today?
Well, it started with North Shore University Hospital, as you mentioned, Brent. North Shore had this idea of creating a health system way back in the early 90s. And it's continued to expand, and we grew by adding other hospitals in the region. We grew pretty quickly. We have done, quite frankly, about 21 mergers, hospital mergers, all of them done quite well. We are pretty good at doing these merger activities these days. So now, for example, if you look at us today, we are the largest health system in New York. We're more than double the size of anybody else. And we're the largest private employer in New York State. But we're very diverse. We have, 23 hospitals, but we have a huge ambulatory network. In fact, 50% of our business is non-acute care, non-hospital. We have about 800 ambulatory outpatient locations, and we have all of the components of the post-acute side of the business. We have home care, nursing home, etc. And we have a major research component, world-famous researchers, a very, very large enterprise with major partnerships around the world. And we are a huge academic teaching place, which is what most people don't fully realize. We right now have 1,950 residents and fellows. We're one of the largest academic teaching places in the United States. So we're multifaceted in a very, very diverse community. We have been growing phenomenally and are continuing to grow. And part of our advantage was that nobody expected us back then to be able to succeed. I mean, we are next to Manhattan, as you know, where you've got a lot of traditional players, very well-known players. But sometimes when you're very, very well-known, you get a little bit complacent. So when we started out, I had people tell me, well, there is nowhere you will succeed, etc. And of course, being a little bit competitive, I like that message being sent to me because when somebody says you can't do something, that's an absolutely wonderful motivator. So today we're in the broad geography of New York, and in Manhattan itself, we have major facilities. We actually today have about 95 facilities in Manhattan. We were not in Manhattan at all about 10 years ago. So it's been an exciting journey, an innovative one, and we wanted to create an organization that was different, that promoted access, that was very diversified and had a broad distribution network so that people could have access to care locally. They didn't have to go to the major hubs to get the best care. And we wanted all components of the delivery system. So, for example, today in New York, we have the largest primary care delivery system. We have the largest ambulatory care delivery system. And we're very integrated as a health system. We have single leadership, administrative leadership, single clinical leadership. I, by the way, am the CEO of every individual entity in the health system. We have common protocols, common standards, very team-oriented, very innovative. We look upon the status quo as being our biggest competitor. I don't look at the other players as our biggest competitors. I look at the status quo as our biggest competitors, which means it drives us to continually push forward, do things differently, be creative, be innovative, take risk, try things. If they don't work, change and try something else. So we're not stagnant at all. We have a very, very good team, and I have been able to build a great team over all of these years. So I quite frankly feel very, very fortunate. And as you probably know, and we'll probably talk about it, We went through the COVID experience here, and when you go through an experience like that, you're humbled by the competence and the courage and the compassion and the dedication of the staff. And at the end of the day, it's all about the staff. I mean, I can only do certain things, but if you don't have the right staff doing the right things on a continuing basis and being passionate about what they do, you're not going to have a good product at the end. So it's been an exciting journey. It's not over. I would say that we're in our teenage years. We're maturing, but I still believe that as an organization, we have yet to reach full adulthood.
You mentioned that you're very competitive. Give me some idea of your own personal history. How did you come to lead this system?
My history is a little bit interesting. As people can probably gather from my accent, I was born in Ireland. I left home when I was young. I left home when I was around 16, and I left home because the situation in my family was not great, a lot of poverty. And I went to England. I dreamed of going to college. I didn't know much about college, but I dreamed of it. I was always interested in education. I went to England working, which helped me pay for my first year in college in Ireland. I then decided I had to come to the United States. I came to the US. I worked down on the docks in the west side of Manhattan, worked in construction, worked as a plumber. I would spend half the year here and go back to Ireland and finish my undergraduate in Ireland. I also played very competitive sports, so I was a pretty good athlete back in those days. And I went back and forth doing that. When I finished college, I came back here to the United States, continued to work in construction and other jobs like that. I went to Fordham University. I got my master's degree, ended up after a number of years teaching at Fordham and becoming full-time faculty member and assistant dean of the Graduate School of Social Service at Lincoln Center. And then I was at Fordham doing that, plus also managing a big campus they had north of New York City. When Governor Mario Cuomo became elected, he became governor. I did not know him, had never met him, but his administration reached out and asked if I wanted to join the administration. And being a bit of a risk taker, I said, why not? The job was in Albany, 3.5 hours from New York. I said, yeah, and then I took the job and figured out how to get to Albany. I went there, stayed in Albany for 12 years, ended up getting promoted, and at the end of the day, I became the head of Health and Human Services for the state of New York. I was the deputy secretary to the governor, his chief advisor on all health and human services. I also became the commissioner of social services of the state of New York. And that was an exciting 12 years, one of the most exciting of my career. Left there, went into the insurance business, was in the insurance business in New York for a while, health insurance. When North Shore University Hospital reached out and asked me if I wanted to join them. And I had written and had talked about building a health system when I was in government. And I knew North Shore was thinking about doing this. I wanted to do it. So I joined North Shore as chief operating officer. And then we continued to expand and grow. And so quite frankly, I've had a very, very fortunate career. I've been very lucky. I've been in contact and have been mentored by a lot of great people. People have opened their doors to me, giving me opportunities. Governor Mario Cuomo, the father of the current governor, Andrew Cuomo, opened many, many doors for me. Many ways he threw me into the deep end. He pushed me, pressured me, but gave me opportunities I otherwise would never be able to achieve. So I owe him a debt of gratitude, as well as a lot of the other people that helped me along the way. None of us succeed just by ourselves. We succeed by the impact all of those others around us have on us. And so I've been pretty lucky and continue to be excited about what I do and continue to be motivated to continue to get better. You've got to be raising the bar all the time. Otherwise, you get very, very static and dormant, and it's just not good. You've got to keep pushing all the time because where we need to go is so far away from where we are. And that's true in healthcare in general. We've all got to just improve continuously.
I know something about your story. This idea that you were a champion athlete, give us a little bit more about that. It's not just a champion athlete, it's a champion athlete in a particular area. And I think that kind of forms the man a little bit. Tell us about that.
Well, thank you, Brent. A lot of people don't know what I'm talking about when we describe this, but I would say you can actually Google it. The Irish national sport is called hurling, Hurling. It is not curling, it's hurling. It's about 3,000 years old. It's a very physical contact sport. When big games are played in Ireland, the country basically shuts down. There are 15 people on the team. You play with a long wooden stick. It's called a hurley, Hurley. The ball is very much like a baseball. It's that hard. It's fair game on the field. There are rules, but you wear no protection. When I played, there were no helmets, no protection. Today, they do wear helmets, but that's about the only protection they wear. And I can hit the ball wherever the ball is. If the ball is in your hand, then you better move your hand. So it's very physical, very, very fast. It is the fastest field sport. If you are afraid of getting hurt, you don't play this game. If you're not competitive, you don't play this game. If you don't have that desire to win, you don't play this game. But I actually enjoyed every moment of it. It was one of my favorite pastimes, and I was fortunate enough to be able to play with all the top teams, all the way from the time I was very, very young, all the way up to the senior ranks. The only games that are similar to it in the United States would be lacrosse or hockey. But imagine hockey being played on a field without any protection. And you can hit in the air, you can hit high up, you can hit on the ground, but you better get your body out of the way, because if the ball is near you, I am hitting it, and you better be fast enough to move.
That's the Michael Dowling that I know.
You can tell I got hit a few times,
well,
including a lot of times on my face. So I was young and looking before I started to play this game.
I think that competitive spirit kind of defines your life, Michael, and really is a big part of the story. You know, building on that, you're quite unusual for a community-based healthcare delivery system. You've successfully built a nursing school, then a medical school from the ground up. Anyone who's carefully looked at Northwell sees your massive successes in biomedical research, your teaching programs. You've led the world in COVID-19. Hey, those sorts of things are traditionally associated with academic medical centers, but you still see yourself primarily as a community-based care delivery system. In some sense, you're completely redefining the academic medicine model. What's the story here?
Well, it's a matter of how you define what you mean by academic medical centers and community. We are a huge academic teaching center. We're the largest in the region here, because you've got to be promoting discovery, new research, and you've got to be promoting innovation in education if you want to be able to change the way healthcare is delivered in the future. So we're community-based in this regard, in that we believe very, very strongly that care should be delivered as closely as possible to where people live. This idea that everything should be brought into a central academic hub, a tertiary hub, and that's where all the good care should be delivered, I think is anachronistic. I think it's old-fashioned. We should be moving the best care out into the community, closer and closer to where people live, and that's what we've been doing. That's why we have expanded our ambulatory network in a major, major way. We've actually taken some of the smaller community hospitals, specifically one of them, and converted into a tertiary campus out into the community, where from in the old days, people who lived in that community had to travel long distances to get the top care. Today, they don't have to do that. They go to care locally. And on education, like our medical school, I have been a strong believer for a long time that if you want to change how healthcare is delivered in the future, you've got to change how you train physicians, how you train nurses, how you train administrators, how you train social workers. You can't change the product if you don't change how you educate people. So that's why we started a medical school, which is very, very different, and a nursing school. In our medical school, for example, all new students are trained as EMTs in the first 9 weeks. They all ride our ambulances. We have the largest ground transport system in the region. So we see ourselves as being stewards of the community, very focused on the community, because our community is very, very diverse, but at the same time being very academically focused. So we promote new knowledge. and very research focused. So we develop new discoveries and promote new discoveries. So you can have that mix without being overly egotistical, without believing that, only all things happen in certain hubs. That's not the way I think care is in the future, especially given the growth of technology and the ability to increase access through the use of technology, not only just care delivery, but also education in the future. So we're constantly, as an organization, looking for ways about how to improve and how to change, how to do something different from the way we did it yesterday, how to be creative, how to throw out the old ways and how to raise the bar. And I tell staff all the time, you're here for a purpose. You're not here just to exist. You're not just here for a job. You don't have a job when you work at Northwell. I tell staff this all the time, and I meet all new employees who get hired here. You don't have a job here. You have an obligation and a responsibility. Your obligation and responsibility is to raise the bar, provide best care to the people in the community as close to where they live as possible, but at the same time promoting education and at the same time promoting research. So you can do them all and be unbelievably community-based.
I think we're understanding some of the real reasons you've been so successful. Now, you just survived the largest COVID-19 outbreak, certainly in the United States, perhaps in the world. Tell us about that. What was it like in the heat of battle?
Well, I tell you, this is an experience that I don't think anybody that's been in healthcare has ever been through before. This was a humbling experience, and I believe it has changed our perspective forever. I know it has changed my individual perspective about life and about relationships and about the future and about your role and your responsibility in the world. I think it has changed the perspective of the organization and our organization. I think it has changed everybody because it didn't just affect healthcare; it affected every business in the area and in the United States. Everybody's affected by this. We've never been through something like this before. So what was it like? As I said, humbling. We saw 76,000 COVID patients. That's the most up-to-date number. We had 17,000 inpatients. Each one of our hospitals, every one of our facilities was converted to being almost completely COVID. At North Shore University Hospital that we mentioned at the very beginning, the one that started all of this, we had at one point over 850 COVID patients at North Shore Hospital alone. So every one of our places was COVID. We had to retrofit every facility. We closed all of our ambulatory networks, all of our ambulatory surgery, all of our community health services. Most of our ambulatory we closed because we needed the staff. And because there's many lessons here, but one of the great lessons is that when you're an integrated healthcare system where all of the components work together in an integrated, collaborative team approach way, you can deal with an issue like COVID crisis better than if you're not organized this way. So we were able to bring the assets of the whole organization together because we all work as one. We were able to load balance, which means that when one hospital got unbelievably busy, which happened to us, we were able to move patients from that hospital to other hospitals that were less busy in our health system. And we sometimes moved them 50, 60 miles away. And we were moving between hospitals in some days 50, 60 patients. So we never got in any one of our places, we never got overloaded with patients because we load balanced. And we wrote a book about this that has just come out, which outlines some of the lessons learned about how you take care of staff, what you should do with regard to PPE, how you deal with the academics and the research and the training. And we got help, of course, from other places. I mean, one of the entities that helped us enormously was a place, Brent, that you're very familiar with, Intermountain Health. And I called the CEO in the middle of the crisis and said, asked him if there was any way he could help us with staff. And he sent about 70 staff to us, which was enormously helpful. We have since reciprocated by sending staff to them because I believe we should be helping each other enormously when we're in a crisis like this. I will end with this by saying that what impresses me the most and what impressed me the most about the COVID experience, because we were at the epicenter, was the dedication, the courage, the compassion of the staff. when you're walking the floors like I did every day, I walked every ICU in every hospital, and you see what healthcare workers do each day in dangerous situations, even though they have their families and they have kids and they got their parents, in many cases, living at home with them. And they walk straight towards the crisis and dealt with it in extraordinary ways. So we should be very, very proud to be in healthcare for what it is we're able to achieve. And we should be enormously proud for the staff who do the work so that people like me can come and talk about it. But it's the people on the front lines, on the floors, in the hospitals, in the ICUs, in the critical care areas, that I think deserve enormous credit for the success that we've had in dealing with COVID. And as you know, right now in New York, we have very few COVID cases. We're in a good position at the moment, and we have put very detailed plans together on the assumption that it might come back later on in the year or maybe the beginning of next year. But lots of lessons learned here, and I think it has changed us all for the better. So while you're in the middle of this, you're saying, oh, this is really tough. But then when you sit back from it, you say, I'm glad I had this experience. This showed our resiliency. It showed the true character of our organization. And those assets we can build upon now going forward to even be better than we thought we could be prior to the COVID experience.
You know, Michael, as you look back across that truly unique and challenging experience, is there any one or two messages that will carry through for the rest of your life and change your leadership style, do you think?
Well, I think that we have, and I've done a lot of this over the years, but I think we have to spend more and more of our time with the frontline staff. I don't think that many organizations, orient them to the organization the way they should. I don't think many CEOs don't get in contact with the front lines the way they should. But when you're in the middle of a crisis like COVID, you realize those are the ones doing the real hard work. Those are the people that, putting their circumstance in danger every day, doing enormous human work. And I think we have to dedicate a lot more of our time and effort making sure that we build the trust, build the loyalty, and make sure that we commit to having our employees as secure as possible. And another thing that is very, very close to me is giving them as much opportunity as we possibly can at whatever level to give them the opportunity to grow inside the organization or outside by giving them opportunities for increased education, et cetera, et cetera.
You know, Michael, I've always thought of Northwell and you, and well, way back in the days of North Shore University Hospital as an exemplar of clinical quality improvement, and you've been highlighting some of those things, at least to my mind, that idea of what you're really setting out to do, that bottom-up management, focusing on the frontline staff, the sharp end where the work happens. Doesn't surprise me that you're chair of the board of directors of the Institute for Healthcare Improvement, the most preeminent quality organization in the world. Is there anything you'd add, though, from just a quality perspective in terms of Northwell's overall strategy?
I think that we need to redefine what we mean by quality. And this obviously is you're one of the real experts in this arena, Brent. But quality to me is a combination of things. It's not just the outcome you have after you come out of a hospital, for example. It's whether or not you can go back to your lifestyle pretty close to where you had it before, where you can assume your job fully. It's not like the things that often bother me is we define success is that if you don't return to the hospital within 30 days of after having surgery, therefore we check it off as being successful. That's a very limited definition of quality to me. To me, is whether or not you have surgery, let's say you have an orthopedic surgery. Now the question is, we should define quality in terms of whether or not you can go back to work again, whether or not you're mobile again, whether or not you have a longer term success, not just short-term success. I also think quality is about convenience. It's about focusing on the customer. It's looking at it from the outside in rather than the inside out. As people at IHI have said, it's not the question about what matters, what's the matter with you, it's what matters to you. And I think we have to be much more customer focused or patient focused. And I use the word customer because I think it catches a broader umbrella. I also think that the COVID issue explained and demonstrated this inequity in a very blatant way, is the lack of access, the lack of prevention, the lack of education, and the disproportionate effect that COVID and other diseases have on minority populations and populations of poverty. We are working very heavily in New York to try to deal with that. So I think it's a real challenge for healthcare going forward, and it's it has to be a priority to reduce those dramatic inequities in the delivery and access to care.
You know, just to wrap up, we have time for, I think, one last concept. You're defining the future in particular ways, taking that quality strategy and extending it one step further. It's a form of pay for value. You call it direct to employer care. Tell us about that, because it's one of the more exciting strategies I've seen.
Well, I did start an insurance company a couple of years ago, as you know, Brent, and we were quite successful, except that some of the rules that were set by the federal government made it impossible for us to continue, which was a real disappointment to me, because I'm a big believer that, at the end of the day, the concept of taking responsibility for totality of a person's care is what's important, not just only the medical aspects of care, but also the social determinants, the lifestyle, the behavior, all of those issues, I think, is all part of the quality agenda. And I think we got to modify how it is we get reimbursed in the future. I know that you have been a strong proponent of capitation. I also believe in that concept. But what we're doing now, to your question, is we're reaching out directly to employers, and have a lot of interest, especially now post-COVID. A lot of employers are coming to us saying, can you help us figure out how to protect our employees and develop the safety standards so that we can guarantee against an upsurge of COVID in our business? But we're also saying that we now can also go to you as an employer and say, while you take care of your business, we'll take care of you. So we're reaching out and in discussion with quite a number of businesses right now for us to provide care to their employees and develop a different financial arrangement. So we say we'll provide full care for all your employees. We will do it on site. We'll do it off site. We'll do it in whichever way you want it. You determine how you want it. You set the criteria with us as how you guarantee, how you assure that your employees have the best outcomes and the best quality. And we will be the provider with you as a partner. And so this is called Northwell Direct, going direct to employers to the extent that we possibly can, cutting out the middleman. Because I think the middleman sometimes causes extra expense, extra confusion, extra bureaucracy that's not necessary. So I think that as this progresses over the next couple of years, I think we're going to see some very innovative things happening. And I believe it will change the way care is delivered in the area. It will also change us, because as I sit now with many of these employers, they're saying to me, I know the way you do business, and I'm happy with the way you do business, and I compliment you in the way you do business. But if you're going to do business with me, you're going to have to change. You have to change to accommodate me as well. And that will change us for the better. So we've got to be open to be willing to look inside ourselves so that we can change the way we do business and not be confined to the old traditional ways of working, which is, I think, is, as I said at the very beginning, that's the status quo, which is the biggest competitor we all have, is fighting tradition. We've got to fight tradition. And so Northwell Direct, going directly to employers, I think, hopefully over time will have a real benefit for everybody and the community in general.
You know, Michael, if I had to identify a thread in our conversation, it's exactly that. Innovation in the past, growing it into one of the most successful systems in one of the most competitive markets in New York, dealing with a massive national crisis, and now defining a new future. As you know, I believe that's where, not just where healthcare is going, but where it needs to go to be all that we can be. Thanks for leading it. Thanks for being an exemplar. Hit that ball as hard as you can, and if somebody gets their head in the way, hit through the head. Is my basic advice to you.
Thank you, Brent. And I've learned from you over the years. I mean, you're very modest, and I remember before I got to know you personally, I used to read all this stuff, and I'd say, oh, someday I'm going to meet this guy, Brent James. I mean, he's an icon. And here I am talking to you, and we've become friends. And this is what's good about it all. I mean, we exchange ideas, we share views, we argue, we come up with different points of view, and we push the agenda forward. That's what it's all about. And we've got to continue to promote a culture of continuous learning, so that we can over time redefine health, redefine what healthcare is, redefine what quality is, and redefine what success is. I think we're too limited in our view about what success is. We should not feel that first of all, you'll never be completely successful, but it's when everybody is behaving in a way that promotes their own health, and we're partners with them in that. That's when I think that we will see real progress. It's not just us versus people, it's us with people, helping them change so that we change, and we both change together. So Brent, you have been a wonderful leader in this field, and it's a pleasure to know you and learn from you and continue to learn from you going forward.
I think that's an appropriate last word, and thank you for your leadership, Michael. I look forward to the system you're going to create going forward. Thank you.
Thank you, Brent. Thank you.